Good afternoon, everybody. Happy New Year. Thanks for joining us. We want to get started with an update. Before we do that, many of you may be watching the news today. Some of you may be following it on live stream. What is going on in Washington, D.C. is not much better than what we have seen in too many communities across the country. Violence against anyone in the cause of anything in a civil society is just not a good thing. To the members of, to those who serve in Congress and those who serve in elected office, I can tell you, because my wife experiences this often enough, their family members are home terrified because what is supposed to be the orderly discussion of this great American democratic experience has turned into chaos in the halls of the Capitol and violence against individuals, and it's just not acceptable. It isn't. I'm not here to lecture you, and I'm not going to spend a lot of time engaged in that. We have a lot of important business to talk about regarding our response to COVID-19 and the rollout of vaccinations, but I just beg of you to be very sensitive and sensible to encourage friends and family that we are allowed to have differences. In fact, that is what makes this country great. It always has differences of opinion and our willingness to express them in a way that does not erupt in violence. And it was frightening those months ago in some cities where we saw buildings being burnt, and it is frightening now. And it is not the very best that we have to offer each other. So debate the differences. Engage in those conversations. I'd ask to not delve or dive into conspiracies, but rather to do your own research, get your information, and to express your opinions. All, not obviously not you watching, because you're watching us and not engaging in that, but just do it in a way that is civil and that is respectful and that recognizes that we have but a very fragile system of government here, and it is dependent on our willingness to accept truth and willingness to accept differences and not to engage in violence against one another. And that is just something that we just cannot devolve into. That's it. I will leave you with that. I appreciate you indulging me. It is a frightening thing, and we all have to dig deeper, especially during a time where so many people are struggling so very hard. So with that, let's jump very quickly to our dashboard numbers. You should be aware, conducted nearly 377,000 tests completed to date, 13,000 confirmed positives over these last 11 months now. We are currently monitoring 1,517 cases, 1,517 active COVID-19 cases, individuals who contracted COVID-19, 156 individuals that are currently in hospitals in Dutchess County with a positivity rate of 8.26%. Now, sadly, we have seen 252 individuals, Dutchess County residents, lose their lives to COVID-19. I was reflecting towards the end of the year of my own loss. Those 252 deaths are human beings that many may have had other health concerns, may have had underlying health issues, may have had some higher risk, but they would likely be alive today had it not been for their contracting a virus that we were unable to control. So these are 252 families that have been impacted, 252 lives that have been taken, and 252 of our neighbors who are not amongst us. That is a concern. And those are real deaths. The 8.26% positivity rate is our 7-day rolling average. We talked about this a couple weeks ago. We did, in the time that we weren't with you over the holidays, Christmas and New Year holiday, we did experience a couple days of relatively high positivity. Now, the state of New York called those statistically improbable, was the language they used, statistically improbable. And what I mean by that is, keep in mind that on any given day, we're reporting the positives that come to us having gone through the labs and been identified as positives. That's not to say that yesterday all of those particular people were identified as positive. These are positive tests that all come together and reported on a single day, but they're tests that occur over multiple days, and depending on where you're getting your tests and lab results, as you likely know, that could be 24 hours, it could be 7 to 10 days before you're getting those results. So we get them the same way. So what the state believes occurred on a couple of those days was sort of this confluence of a number of positive tests came together at once, and at the same time we saw a dip in the total number of tests being administered on those given days. And because of that, mathematically, it created a number that was a little bit higher. It was, I think, we're at 10.2% positivity. Now, again, we're trending, our positivity rate is continuing to trend upward. But those that particular 2 days, they refer to, and we agree, is improbable. Not necessarily that it was part of a spike, but rather just an improbable confluence of some variances. In fact, I think Sullivan County was at like 15% those same 2 days. So that said, positivity didn't spike with that same degree over a period of time, but it is growing, and that is obviously something that we have to monitor. Just as a reference point today, we're monitoring 1,517 cases. And that positivity rate of 8.2, well, that number's not the same, just so you know. The chart says 8.6, but we were at 8.26, so the graph says 8.6.
It's a day difference.
Oh, is it? This is the day. Okay, so this is yesterday's 8. So nevertheless, one of them, but we're at 8.6%, and you compare that to Orange at 10.6, rolling average 9.5 for Rockland. For Putnam, 8.2 for Rockland, 8.4 for Sullivan, 8.08% at Ulster, and 7.7 for Westchester. If you go back 2 weeks ago, we were monitoring 1,494, so 1,494 cases monitoring 2 weeks ago, now at 1,517. We did get a question that came in over the last week about, you see positive cases occurring, but the dashboard numbers they're not going up at the same rate. Yes, remember a couple things, remember what a few things that are important, right? So as positive cases come in, we report those positive cases. They get identified in the municipality of residence as we verify that information. But every day at the same time, there are individuals that are being removed from the list, sadly, because they may have succumbed to the virus, or they are identified as recovered. 11,421 individuals recovered. So on any given day, those numbers are positive cases coming in and formerly positive cases going out, relatively at the same pace. And if we have 150 people coming in today, it is likely in 14 days we will have 150 people go off. So a lot of that pace, a lot of those numbers start to level off. Okay, so I think that's that's important. Good questions that we're going to get to, and I apologize if you have a question. Write it in the comment section below the live stream, and we will get to it. Let's jump to vaccines and the vaccination programming. Susan, shouldn't the governor have a plan to distribute vaccines? Yes. So let's talk a little bit about where we are. So keep in mind, vaccine distribution based on the federal instruction vaccine distribution is determined by the states, and the state of New York determines how many vaccines get distributed to what locations, and ultimately who qualifies to choose to access and get the vaccine. The state makes those rules. Worse than that, the state also creates the systems that you and I have to jump through in order to register, to sign up, and to ultimately get a vaccine. The governor in the state of New York decided to create this regional hub system. And with Mid-Hudson Regional Hospital, Westchester Medical Center, acting as the hub hospital for the Mid-Hudson region. Now that came out of the expectation that we would all likely need a significant amount of storage for these vaccines. And so that was a variable that we understood, and hospitals had some capacity to do that. But I will tell you that the current structure is not working. It isn't. It couldn't have worked because of the expectations, and I see that Lori asked about Vassar among the bottom in vaccine distributions and what's being done to fix that. Well, let me get to that question, and I will. The hospitals were never built for vaccine distribution. They don't do it with with regularity in the broad way in which you would want vaccines to be administered. They don't do it for flu. I mean, they administer flu vaccines, but they're not part of that infrastructure. So the state said to them in a very short period of time, very short meaning like a week, said to them, you're going to be the points of distribution and you're going to coordinate this entire regional vaccine distribution program using tools that we haven't yet created. In doing that, what the state did was, in essence, push aside the public health vaccination plans that we are mandated to have and are established by county health departments. So in New York State, public health at the local level is administered by county governments. If you go to other states, the county health department is likely a state office. In New York, the county health department is a county office. And so for the last decade, we, along with counties across the state, were required to create vaccine distribution plans. In fact, we establish them, we update them annually by mandate. You've heard me talk about mandates. State mandates us to do things. We're mandated to create these plans. Those plans are to be tested and they're to be updated annually. And in October of last year, 2020, we were instructed to update our plans with the expectation that they would be activated initially for vaccine distribution. That didn't happen. Now, I'm going to take one issue. One of the spokespersons for the governor says, well, we don't want 62 separate plans across the state of New York, so we're just going to meld them all together. That is also not accurate. There are not 62 separate, different, and distinct county plans because we all create the plans within the mandated language and expectation of the federal and state government. Those plans are the base of operation for vaccine distributions. In fact, when I became county executive in 2012, we conducted a vaccine distribution test. We test and train against those. In fact, we had actors and we participated in this wide response to what was a potential for a public health crisis, a pandemic. And so we're required to do that. There are not 62 separate county plans that are distinctly different. There's 62 plans that get implemented based on the protocols and the expectations that the state and federal government have and public health officials expect. Those were shelved, and instead this system was created, and it isn't working very well. And I think the governor understands that. I do. We heard yesterday and today some movement in the direction of activating those county health plans, those local public health vaccine plans. So to Lori's question, Vassar Hospital's numbers reported by the state several days ago were not accurate. They just weren't. And part of it is because the database system wasn't working. And so our hospitals have been aggressively vaccinating individuals. Whether or not that data is being compiled by the state of New York, I couldn't tell you because the system is sort of being created as they're doing it. But we have asked for three things. We think that county public health departments need to be able to activate our vaccine plans as broadly as we expected. And with that, we need to have access to the data. We need to know how many vaccines are distributed in any particular county, what percentages of the population that we're targeting have already taken part in vaccination, and then can we move vaccines from one location to another if they're not necessarily being utilized at any given point in time. That's not happening today. It just isn't. That needs to happen. Secondly, healthcare providers, healthcare professionals, your doctor, your doctor's network, they still are not certified in many cases across the state of New York, and certainly ours, are not yet certified for vaccine distribution. They can't even vaccinate the staff that are taking care of patients with COVID-19. That has to happen immediately. If you do those two things immediately, you can then make the system a bit more efficient. Now, we also believe that the categories, and we'll talk about those, should be altered a little bit. We'll talk about those. But, Susan, there should have been a reliance on those plans. We're trying desperately to get the state to take advantage of that infrastructure that exists. We've got a good hospital system, Lori, that is working very, very hard, but it was never intended, their responsibility was never intended to be this. And so they're doing better than the state reported, but it is going to be a challenge unless we get those other things activated, the Caremounts and the children's medical groups and those particular networks, and other networks, if they have access to be able to vaccinate, then we'll be able to move this along a bit more effectively. So I think those are two things that you should know. Chris, how can private clinics get staff vaccinated? You have to go through the hub. If you work for a private healthcare clinic, First, your employer should tell the New York State Department of Health that they've not yet been certified to conduct vaccines. They should also reach out to Westchester Medical. They have been given a contact to do that, and they should ask for that. We are asking for that. On every call, we had our first regional call on vaccine distribution on Christmas Eve, and on every call, I say three things: activate the vaccine plans, get healthcare providers certified. In fact, the certification process is so long and so complicated that it's delaying getting clinics like yours or institutions like those certified. And third, we need to come up with a plan for people who live in New York State but get their healthcare outside of New York State. For instance, Eastern Dutchess County relies a great deal on hospitals and healthcare in Connecticut, and as of today, you can't go to Connecticut or vice versa to get your vaccines. So we have to create an entire infrastructure in Eastern Dutchess in order to accommodate. So Chris, that's the answer at the moment. Amy, I'll get to the question regarding Dutchesses and the cluster criteria. I want to do that right after I get to vaccinations. Can the town totals, Jeff, be added to the dashboard? Vaccine totals? Jeff, if you want to ask again, you can. The totals for total positive cases are the current active cases are updated and are updated regularly based on municipality. There's always a bit of a delay as we're verifying data, but that information is there. If you're looking for the vaccine information, we don't have that. We've not been given it, and the state is not providing us access to it. So New York State has establishes the guidelines. Starting this past Monday, we are in phase 1A, correct? Phase 1A. So if you look at the chart here, phase 1A is where we are. The state has established those that criteria. That's for outpatient and ambulatory frontline, high-risk healthcare workers of any age to provide direct in-person patient care. That speaks to getting the vaccines to the facilities who can vaccinate their own staff. Home care workers and aides, hospice workers, personal care aides, consumer-directed personal care workers, staff and residents of nursing homes, skilled nursing facilities, and adult care facilities. Those are all able to begin this week. So if you're looking for this information, you can get to it through our website, but it will link you to the state spreadsheet, and you can see the classifications. None of this have dates associated with them yet. So currently, we're in week 4. Currently we're in phase 1. Let's not use weeks. Currently we're in phase 1A. The state will tell you when we're in the next phase, 1B, and so on. But as I said, we're pushing to open the spigot just a little bit, assuming we get the vaccine plans implemented at the local level, and then the healthcare providers the vaccines that they need. This is all the state's requirement and state's responsibility. We're pushing on them. So yesterday, Dutchess County, though, for the county's perspective, Dutchess County opened our first pod. That vaccine distribution point for us was to provide vaccines to our frontline responders, our current home health care providers, and our medical reserve corps staff. So we're vaccinating the vaccinators at this particular pod. It opened up this week. That's where we are currently. So the folks in county government who participate in vaccine and vaccine distribution, they have access to being vaccinated, and we began that this week. So we're now awaiting guidance on the next groups to become eligible. We're still working to set up our own distribution points, but here's what you should know. Dutchess County will move forward with the opening of 2 points of distribution, 2 vaccine centers. One in Western Dutchess, one in Eastern Dutchess. We'll announce those locations once they've been finalized. They're being finalized. We have the plan to do that, but we'll announce them once they're finalized. But we have 2 base camps, one in Western Dutchess, one in Eastern Dutchess. That will be part of a network, right? Because again, hospitals and presumably healthcare providers will also have access to vaccines. We will plan to get those up and running at some point next week. So the goal is Eastern Dutchess, Western Dutchess. These 2 locations will open. We're partnering with Nuvance for the third point, if you will, of sort of county government partnered points of distribution at Northern Dutchess Hospital. So Northern Dutchess Hospital capacity is being expanded. And those who qualify, the people that are qualified under the state regulation to access the vaccine, will be able to go to these 3 points of contact through the county system or the hospitals or your healthcare provider when the states provide them access to the vaccines. So we need you to be patient. We're continuing our process of opening up these points of distribution. That's part of the vaccine distribution plan at the local level. We'll have some 50 individuals already ready to administer. We have a Medical Reserve Corps volunteers who are participating, and we will operate and function these vaccine clinics, if you will, over the course of the next several months, beginning at some point next week, and we'll get you updated on that. If you have a question regarding if you're on the list, when you're on the list, what the next steps are you eligible for a vaccine, you can visit ny.gov/vaccine. This is to determine your eligibility and to schedule ultimately an appointment should you be eligible. ny.gov/vaccine. Can they get to that at duchessny.gov/COVID-vaccine? You can. So if you visit duchessny.gov/COVID-vaccine, you'll get some of the information about our operation, and you'll be given the links to the state to conduct to determine if you're eligible, and then to schedule your appointment. You can do that through duchessny.gov/COVID-vaccine. I will tell you the state's website system is still being worked out. So in some cases, you'll want to register an appointment. As of a couple days ago, they were sending people to the Dutchess County Health Department website. We don't schedule the appointments; it's all through the state system. So we're as bugs are identified, we're telling them to fix them. But you'll go to duchessny.gov COVID-vaccine. You'll determine through the state's link your eligibility, and you will file for an appointment through the state, and then assign a location to go. Next week, one of those locations could very well be the Western or Eastern Dutchess points of distribution that we're opening, or Northern Dutchess, or any other of those providers. Let's get to a few more questions. Amy, we do not meet any of the cluster requirements or guidelines as it stands today. We're getting close to that 9% number that historically had meant that schools may have to close, but the governor changed that this week. Schools don't have to close when you exceed 9% if school positivity rates remain below the community positivity rate. Anyway, we are not encroaching upon a cluster designation, and those micro clusters, remember a couple weeks ago they were looking at like neighborhoods, that is almost off the graph any longer. It's really, does the county or does a community within the county exceed certain positivity rates, which we do, but also hospital capacity, and we're not yet in a position where our hospitals are pushing against the higher end of capacity limits in the state. So that you should know. There was a question regarding Billy. Billy is the new COVID strand in our area? The short answer is, while it has not been tested, but you should assume it is. This is not the Saratoga Springs strain of COVID-19, and it is not the UK strain of COVID-19. It is another strain of this particular virus that does seem to transmit more easily. And it is likely in our community, and it has likely been in our community for weeks now. Dr. Fauci, of course, argued a couple days ago that we should have expected it anywhere in the country, anytime. It's not been tested yet, meaning no one's come forward and said they have a positive. But if it is in Saratoga Springs, New York, and it is in Georgia, and it is maybe in Florida, I don't remember the other state, it is, what's that?
Montana.
Sean's telling me Montana. Sean is 6 feet away from me wearing a mask, as he has been for these last 12 months. Montana, not Florida. It is likely in our community, and we should assume that it's in our community. So just be safe and to continue to follow those protocols that we know do work. Those protocols are basic, right? Wash your hands, personal hygiene. If you're not feeling well, stay in. We'll get back to that in a moment. Monitor your own health. Small social gatherings. Wear a mask. And engage in that physical distancing. Claire, how can we find out how to get a vaccine? Call your doctor, call the health department. You can call your doctor, but as I said, visit duchessny.gov/COVID-vaccine. If you go to this website, it'll link you to the state information, and you'll be able to determine whether or not you are eligible, and if you are, you'll be able to schedule an appointment. Will the vaccine help against the strain? I do not pretend to be a doctor. Here's a little known fact. I was named after Marcus Welby, MD. I thought, I wish most people think my mother was some great Latin philosopher, or maybe she named me after somebody famous like that, like Marcus Aurelius. I was named after Marcus Welby, MD, a television doctor, and I'm not. I'm neither. This is what we know about the science of the vaccine. They've not been able, obviously, to test against the strain yet, but there is a belief that the strain is not. It's not the language that was used to us yesterday by a CDC physician was that you discharge more of it than the previous strain. In other words, as you sneeze or cough or talk, more of it escapes, and therefore it is easier to infect someone. That is what they believe is this strain, that this strain escapes your body in a more effective way to contaminate, to infect someone else. So they believe that this vaccine ought to affect it. But I'm not going to tell you that I know that for certainty. We're going to have professionals in to answer those sorts of questions, but they believe, the CDC and the healthcare community believes that these vaccines are effective for this strain and this alteration or mutation. And again, I hate to use that word because it's got a science interpretation, but this alteration of the virus, they believe it's effective, but we'll get you more information and get people who have the answers to answer those questions. Are all healthcare workers included, such as dentists? Dentists are included under the current. So it's all frontline. Those, if you're having direct patient care, you're on that list, and therefore, again, dentists, orthodontists and their staff, doctors and staff, RNs, specialty medical practices, home health care, all of those qualify, and you should visit dutchessny.gov/COVID vaccine to get more detail on scheduling. Now, we've shared this information with the Dutchess County Medical Society and others, so hopefully your employer, if you work for a physician or a medical practice, will get you that information, but you can sign up, register. Sarah, what are we doing to encourage people to get the vaccine? The number one thing we can do to instill confidence is to effectively manage the vaccine distribution. We have got to get this organized in the state of New York in a way that instills a degree of confidence. In the meantime, though, we are, as a region, developing our outreach efforts. We're going to begin on these calls with you, or these town halls with you, to have the healthcare community come in to answer questions and to respond to some concerns. I also encourage people, I follow the Mayo Clinic. If you're online and social media, the Mayo Clinic has a really good way of sort of compartmentalizing some of the details of the vaccine, and we're going to be sharing those kinds of that kind of information with you, and we're going to encourage people to make the choice for themselves. We need you to feel confident and comfortable in doing that. We're going to be partnering with a lot of community stakeholders that are sort of trusted sources in their neighborhoods and community to explain and answer questions, not medical questions, but to get the details available so that we can help individuals understand the vaccine and make the decision that they feel is best for them. We're going certainly to encourage that. I will be getting the vaccine when it's my turn. I'm not. I have already expressed my displeasure with elected officials jumping in line. I do think that all of those important and critical care workers and senior citizens ought to have access sooner, certainly before someone like myself. But I hope that will encourage people to at least keep an open mind. But we're going to be providing more information, more outreach, and more communication about the effectiveness of the science behind, and then answer questions. And then you ultimately will make that choice for yourself. And then we're going to be doing that. When will educators be eligible, like college students and school teachers, etc.? We believe that falls in the phase 1B. We think it's 1B. First, yeah, here it is. First responder. 1B is first responders, teachers and education workers, public safety workers, public transit workers, people 75 and older. We think that we ought to advance that, but there's no date on that yet. But 1B is that category, and visit dutchessny.gov/COVID vaccine for more information on your eligibility. Patricia, is there a plan to notify eligible people like seniors who don't watch online forums? Yes. there is going to be a lot of outreach that occurs. It's going to happen through a lot of the organizations, healthcare providers, Office for the Aging. There'll be communications in the newspaper. There'll be outreach through newsletters. We'll be doing more outreach than just social media town halls. We're going to reactivate our telephone town halls. A lot of senior citizens, for whatever reason, took my phone call and listened to an hour long of our town hall meetings when we did them earlier. We're going to start those again this month. There'll be continued outreach to get to all communities to help individuals make that choice for themselves. Leslie, do schools need to test 100% of its students and teachers before reopening? Before reopening now? No, right? So, meaning this week, or if they're forced to close, there is a testing protocol. We can pull it up. You have that, Sean? Schools can stay open if regional infection rates are over 9%. Mentioned that, and that there is a testing requirement, but it's some percentage of the whole. We'll confirm that for you, but it's not 100% testing, and certainly not every teacher and not every student need to be tested before reopening now. So if they're forced to close, because of positivity rates, there's a testing structure that goes into effect to stay open, but it's a percentage of the whole. It's not 100%. Some more information regarding the zones, but there's a testing requirement, but it's not 100% of the population's percentage over time. John, my mom is 75. Is she eligible yet? No, not yet, although I believe she should be, and I think we have the capacity to do that now. She would be qualified likely for 1B, especially if she has an underlying health concern. So let's talk a little bit about positivity positivity. Let's be positive. Let's talk a little bit about what happens when you test positive. We are launching this week. Dutchess County is launching a text communication tool. If you test positive in Dutchess County and you have provided your cell phone number to the lab, to the physician, and we'd encourage you to do that, you will get a text message that informs you immediately of your responsibilities under the state guidelines. So we're launching that this week, texting to positive cases. You'll receive a text message. That message will tell you that you've been identified as someone who has tested positive and that you must engage in these following steps and visit a link to get more information. That way we can keep pace with positive cases if we have your cell number. So that information you give that information when you sign up and register for your appointment and ultimately your test. If you give that cell number as you do that, we'll text out if you happen to test positive. You'll likely get a call from your physician confirming, but we'll get a text message out to you as an effective way to keep people aware. And we hope that this tool will give you the information you need when you need it in order to immediately begin to take steps necessary to protect yourself and others. So what do you do when you test positive? Begin to isolate. You do not need to wait for a phone call from the health department or from a contact tracer or a text message. If you get a message that you test positive, please begin to quarantine and isolate yourself. The state of New York says that isolation is for 10 days following the beginning of symptoms or the positive test. And do yourself a favor, do your friends a favor, and do your community a favor and notify those that you believe you've had close contact with. I know that list might seem a little bit complicated or large to think about, but if you test positive, begin to quarantine. Remember, you're going to do that for 10 days after the positive test. Begin to notify those that you're in close contact with. Tell your husband or wife. Reach out to the coworker that maybe you share close proximity with. Maybe you were with a family or a family member or friend for a particular period of time. If it's a close contact, tell them. And if you've been called by a neighbor or a friend and they've tested positive and you have had close interaction with that individual, we need you to begin the isolation process as well and then get scheduled for a test. All of those are the things that you can do to slow the spread of the virus. And you could be sitting home saying, I don't like any of this. Well, that's lovely, but the rules, the guidelines are what they are. And so if you test positive, you're going to have to quarantine, and we need you to do that. But even so, right, if we want to turn this around, we want to slow the spread of the virus, we want people to stay healthy, we don't want to have to shut things down any longer, we want to be able to get back to some semblance of normal, although these days I'd like to do better than that. We're all going to have to make the personal decisions that keep the virus from spreading. So if you're not feeling well, please stay home. This isn't the time to take your sore throat and your stuffy nose and your headache and go out and socialize with friends and family. It just isn't. Because one, you're putting your own health at risk, and two, you're putting the health of others at risk. So if you test positive, again, we have this new text message system. If you gave us your cell number, you're going to get that text message. But either way, begin isolation for 10 days. Notify your close contacts. Those close contacts who are within 6 feet for 10 minutes or more of an individual test positive within a 24-hour period. When that individual is contagious, please begin to isolate and then schedule for a test as well. And then if you after those 10 days pass and symptoms have subsided, or if you test out and you have no symptoms, you can go back to normal activity. So again, 10 days if you test positive for isolation. Continue monitoring those symptoms through day 14. We want you to take those preventive step measures and also to notify your friends or those you might have had contact with. How is the county text system different than the state's contact tracing? It is entirely different. One, the state's contact tracing will get to the positive case and a contact tracer, and a contact, but all of that takes a little bit of time. And because of that, what's happening is in every part of the state, the contact call may be the State Department of Health call may be several hours or several days, and we've had some fall through the cracks. It's clearly happening that there are individuals who are contacts that maybe didn't know they were getting a call or didn't answer the phone. That information isn't getting out as effectively. This text system will simply say to you immediately upon our notification that you've tested positive, here are the steps you must take. And then from there, the contact tracing process will begin. It doesn't supplant it. It just activates the system a lot quicker so that you can make the decision to begin to isolate. So that it's belt and suspenders is the question. Is how I'd suggest it is. When will vaccines be available to county employees? When you qualify. Some county employees already qualify for vaccines. It is not, the county employees is not a category of people that the state has identified as qualifying in mass. Instead, every segment of the public employment sector will be the same as the private employment sector. When you hit a category that is identified by the state, at that point in time, we will facilitate vaccinations. You can do that through your physician. You'll be able to do that through the hospital, or as a county employee, you'll be able to also do that through one of the county points of distribution. But currently, county employee is not a category that falls within the identified qualifications. It's rather what is the task or the responsibility, what's the risk level, and those things are established by the state. Although, again, Sean, can you pull up the 1A, 1B, 1, just as a reference, we're in 1A, but you can see in 1B, first responders. That'll include everyone likely in the law enforcement community, and likely to some degree probation, likely to some degree, certainly corrections officers and road patrols, but also then public safety workers, public transit workers, teachers and educators. So that 1B category will be another large, certainly public employer segment as well, and we'll keep you posted when the state makes that clear. Do we know if people have had allergic reactions to the vaccine? People are having what are reactions to people who often have reactions to a shot or a vaccine are having reactions. For instance, when I get the flu shot, I have an allergic reaction. That allergic reaction is soreness in my arm for likely 36 hours. A little bit of puffiness, a little bit of swelling. That's a reaction. Some people have a stronger reaction, right? And we know that. But what we know of the science today, and I'm telling you what I have learned over the course of the last week, is that the reaction to this vaccine is not different than the reaction that people have to vaccinations. And vaccinations do come with, you take something from the outside and put it on the inside. Some people have an allergic reaction to that. And so the reactions that people are seeing, some are more severe than others, but we are told from the data that it is not uncommon and it is not different than what we experience when any one of us gets any other vaccine or shot that you might get. There is always the possibility that you or I may react to that slightly differently or with some degree of reaction. Most people, and this is, again, CDC advises us, State Health Department communicates with us, and our own team educates us. What we hear is the general reaction is soreness, a little stiffness, a little soreness, and that is generally what's occurring overwhelmingly. But there are some who do have a reaction, and you should go to the FDA's website. You can go to the county's website. We'll get you the state website to help you answer some of those questions. If you do have some sensitivity to vaccinations, you should call your physician. Well, either way, call your physician, but ask those questions. I just cannot and can't be in a position to give you any advice. Just be sensitive to that, right? Leo, I have a heart condition. When can I get the vaccine? Well, I don't know your age, but if you fall in the 1B category, if you're over 75, you might qualify in the 1B category. Otherwise, the categories are this: phase 3. Well, phase 2 is general public with very high risk. So it's possible somebody with a general public with high risk would fall into phase 2. Phase 3 is 65 and older and sort of general access. So right now we're in phase 1A. We're moving to 1B soon. And then the state is having these phases. So it would seem to me if you have higher risk, you'd fall in the phase 2 category. I cannot tell you that date because the state has not said so, but that's something we'll inform you as soon as we know. Richard, why can't seniors with cancer and other issues get it? The state of New York says you can't yet, and that's a challenge that we think, or a limitation that is not necessary. We do think that if you activate those vaccine plans at the local level, if you put vaccines in the hands of healthcare networks and family practices, if you rely on that structure, you can get vaccines to more people. And that is something that we are very interested in seeing happen. How long do you think it will take our county to be critically vaccinated? Eileen, I don't know that I understand the question entirely. The goal is to get to 80% of the entire public, right, by the end of the year. I know that the goal is by summertime to get to have general population access, and so the goal is to keep ramping it up and get access to as many people as possible, and so they tell us 80% is herd immunity, but I assume to some degree that's 80%, meaning people have contracted the virus, people have taken the vaccine. That said, we're just in a process to educate, ask you to make that decision, and then make sure we have ease of access so you can get that vaccine. So it's going to take several months for us to get to a point where there's broad public access, and we're just going to participate with the state in that effort. So went through the texting, right? Talked about close contacts. Let's do a bit of good news, right? Want to, if you haven't already heard, Empire State Trail opened up last week. This is this massive connection, basically, of trails and road networks across the state. But we're very happy that the trail cuts through Dutchess County. So the Maybrook line of the rail trail. This is a trail that actually is adjacent to the rail bed. That's open from Pauling to East Fishkill. Did I get that right? And then, of course, East Fishkill connects to the Dutchess Rail Trail, to the walkway over the Hudson, and so on. So those are open, as is the Harlem Valley Rail Trail extension way up into Columbia County. So our two trail networks are open, and we're very excited about that. If you have a question, write it in the comment section below the live stream. Otherwise, we're going to begin to wind down. Again, if you have questions, keep in mind that Dr. Wythian, I know Wythian does regular updates that we've been producing, video updates twice a week, Mondays and Fridays. And a good way of getting some of the questions you have throughout the week. We try to feed them to him, and he'll attempt to answer some of them throughout the weeks. We're going to continue to work with our healthcare providers, continue to work with the state of New York to expand access to vaccines, and keep you updated on testing. If there are no other questions at this point, again, I want to thank you for participating in our town hall today. We're going to be live again with you next week. We will have a telephone town hall this month. It'll coincide with a Facebook Live town hall, and then we'll get back into the process of getting regular telephone town halls to you, so we can answer more questions as we get to this critical stage of our response. And so, in the meantime, again, if you're not feeling well, please stay in. Please try to isolate yourself so that you don't risk your own health and the health of your neighbors or friends or family. If you have tested positive, please adhere to the isolation requirements and contact those people you may have had close contact with. And if you have been in close contact with someone, please isolate yourself and seek getting a COVID-19 test. And in the meantime, let's hope that all of you stay strong, keep healthy, and please for the love of God, be kind to each other.